In June of this year, 36-year-old Miriam Abdul gave birth to a healthy baby girl. It was her 11th delivery in the last 11 years. Ronaisa is Miriam's only 5th surviving child. Her other children died either in a miscarriage or during childbirth. Natives of Sultan sa Barongis, a 4th-class municipality in Maguindanao, the Abduls are poor. Miriam almost always gave birth in their nipa hut. It is still a custom in this rural area for mothers to deliver their babies with the help of a hilot or traditional birth attendant. Losing her 3rd, 4th, and 5th children in a row, Miriam was advised to give birth in a hospital to break the supposed cycle of bad luck. Because the Abduls had no money, she was able to heed friends' advice only on her 10th pregnancy. Unfortunately, the baby was stillborn. Last year, pregnant Miriam had her first taste of a prenatal checkup courtesy of the town's health workers. Called Buntis Patrol, an initiative of the local government, health workers went house to house to check on pregnant women. They made Miriam realize the importance of maternal health care.
Natakot na ako na baka mamatay na ako kasi marami na akong anak. Maganda doon ka mag-anak sa center kasi kung nahirapan ka, mayroong nakatulong sa'yo. Kung dito ka lang sa bahay, hinihintay ng maghilot ang paglabas ng bata kaya nahirapan kami manganak.
Previously ravaged by armed conflicts, Sultan sa Barongis, or SSB, is part of the autonomous region of Muslim Mindanao, the country's most impoverished region. Since its creation in 1989, ARMM constituents have endured limited, if not complete, absence of access to social services such as good roads, quality education, potable water, and medicines.
Hindi-devolve yung health sa amin especially dito sa ARM. So, kung hindi ka magporsige na bilang mayor, kung hindi mo i-adapt yung health na maging priority sa iyong panunungkulan, talagang mahihirapan ka.
The town's birthing clinic, constructed through the assistance of Zuellig Family Foundation, is at the heart of SSB's priority and commitment.
Para sa amin, kahit walang tulong ang government, national government, basta ikaw, prosecuted ka na leader, talagang may magagawa.
The health centers, which were conceptualized in 2008 and completed in 2010, have saved lives. In 2008, only 1 pregnant woman died due to profuse bleeding. From 2009 to 2010, it became 0 maternal mortality. Latest statistics show that 162 out of every 100,000 Filipinas die every year due to childbirth complications. The Philippines has set a target of 52 deaths per 100,000 live births by 2015 as part of its Millennium Development Goals for Health. The prospects of achieving this target nationwide are not encouraging. In 1991, healthcare was devolved to the local government. Because local leaders were totally unprepared for the giant task, health outcomes in their jurisdictions deteriorated. Part of the Philippine healthcare sector for years, the Zuellig family decided to make the foundation an active partner of the government and stakeholders in providing sustainable healthcare programs and services.
The main objective of the Zuellig Family Foundation is to assist in public health reforms, which means to make health programs and services more equitable and sustainable. When you go to the rural areas, it is really our kababayans there who suffer from inequities in health service. It is a statistical fact that only 30% of our country's health workforce is employed in the public sector, and yet servicing 70% of the population that cannot afford to pay for health care. Our first objective, therefore, is to help build the health leadership capability of our municipal leaders.
In 2008, the ZFF Board of Trustees adopted as special focus the empowerment of local leaders. This is the first step in the Foundation's new strategy called the Health Change Model.
It's divided into 4 segments, each one a prerequisite for the other. Here at ZFF, we believe that health outcomes for the poor will improve if they are given better access to innovative and targeted health products and services. These products and services will be made available if institutional arrangements are responsive. But these institutional arrangements will only emerge if the leaders of these institutions are pro-poor and are greatly influenced by the decisions of the community. So the key really in the health change model is responsive health leaders.
The Foundation, through the Community Health Partnership Program, pilot tested the model initially with 9 rural municipalities. Called Cohort 1, the trial was meant to assess specific improvements in the health situation of the community in terms of lower child and maternal mortality, malnutrition and morbidity, and mortality from infectious diseases. In a province 500 kilometers north of Sultan sa Barongis, the health change model led another local chief executive to own his municipality's health problems.
Nung pumasok ako sa Zuellig, hindi ko alam kung kung saan ako pupunta. So, nung nag-usap-usap na, doon ko na-realize na it's a partnership. They provide technical assistance. No? Pero yung pinaka-importante doon yung the way they guided us, kung paano gagawin, kung paano mag-umpisa.
Embracing the partnership with ZFF, Mayor Bo Escutin became proactive. He made health a priority for Daohons and decided to train all barangay officials who now implement various health programs in their areas. With Dao's leadership more involved, the constituents started to improve their health-seeking behavior. This happened to Cecilia Alfaro, a 26-year-old mother of 2 who became more diligent in taking care of herself and her children's health after the opening of Dao's Health Center.
Mas maganda kasi ina-activate nila ang mga tao. Pag ikaw isang buntis, may sabihan nila pumunta ka doon sa center para ma-check up ikaw. Pumunta talaga yung mga mamayan doon para maiwasan talaga yung mga kasakit.
Since the health change model was introduced in Dao 3 years ago, the municipality has had 0 infant deaths for 2 years and 0 maternal mortality in 2010. The infant mortality rate in 2008 was 25 per 1,000 live births. These pockets of good news in Sultan sa Barongis and Dao have been replicated in 28 more partner municipalities. This is just the beginning for the Foundation's health change model. Its current partnership with 30 municipalities is a perfect starting point. 157 health leaders and 535 frontline health workers trained all over the country and close to 1 million people benefiting from health facilities and programs from the joint projects.
So you see, these improvements show the value of leaders, owning health issues, engaging stakeholders, and promoting innovations in public healthcare programs and services.
With only 4 years left to achieve the country's Millennium Development Goals, ZFF believes that through the health change model, revitalized local leadership will emerge and play the crucial role in attaining, most especially, Goal 5, improving maternal health. The Philippines has not made significant headway in meeting this particular goal, along with eliminating hunger and poverty. But the successes of Dao and Sultan sa Barongis in the area of maternal health hold so much promise.
Time is of the essence. Our vision is to help uplift the lives of the poorest of our countrymen. That is why, if you've noticed, we're focusing our initial efforts on the priority regions of ARMM, Bicol, Mimaropa, Eastern Visayas, and Zamboanga. We cannot do it alone. We need help in addressing the other MDGs. We need more government and private sector partners in education, access to medicine, microfinance, nutrition, health facilities, livelihood, and technology. We appeal to corporate and civil society organizations to help us in this very important mission.
The Foundation's Health Change model has given many local leaders the confidence to take care of their constituents and advance their municipalities' progress. The challenge is to help them sustain the effort.